Good morning, everyone. Leanne Clark-Shirley from ASA. This morning's keynote is about inspiring people of all ages to be ready to care. And I'm pleased to introduce Erin Albers, Vice President of Social Purpose at Home Instead, to kick off Day 6 of On Aging 2021. Erin, welcome and take it away.
All right. Thanks, Leanne. So happy to be here. Today, I'm joined by a very impressive group of panelists who are all about making the world a better place to age. So thank you all for joining us. And we really hope that you leave this panel inspired and ready to continue the great work that you are already providing seniors in your communities. As Leanne said, I'm Erin Albers with Home Instead Senior Care, Vice President of Social Purpose. At Home Instead, we know that not all seniors will experience our service, but we really feel strongly about being able to provide all seniors and their families with something. So my role specifically is to focus on preparing communities to be ready to care for seniors through actions of giving, learning, and serving. And I will be moderating today's panel. So I want to first by introducing you to our panelists. Dr. Jennifer Olsen is an experienced epidemiologist who serves as the executive director of the Rosalynn Institute for Caregivers. And they promote the health, strength, and resilience of caregivers throughout the United States. Next is Helen Adeosun, the CEO and founder of CareAcademy. She has built a career driving outcomes for adult learners and finding meaningful ways to engage in learning. She actually launched CareAcademy to unite cutting-edge education strategies with the unique need of historically underserved caregiver communities. More than 10,000 caregivers have completed over 500,000 CareAcademy classes, and the company is aiming to reskill more than 1 million new home care workers by 2023. Her company has actually been named one of the 100 most innovative ed tech companies in North America and was a prior global winner of the MIT Future of Work Challenge. I believe we are still waiting on panelist Hartman O'Connell to join us. He's having some technical difficulties. Ian supports AARP's social mission by providing analysis and strategic guidance on high-profile policy topics that relate to the development of innovative products and services. And over the past year, he has actually partnered with the organization's caregiving team to explore the unique challenges that are facing younger family caregivers. And Natalie van Oldenburg is from Omaha, Nebraska. She is a graduate from the University of Nebraska-Lincoln, and she has a degree in biology and nutrition science and a certificate in gerontology. Natalie has been serving as a champion of aging through Home Instead for the past few years at the Stevens Center here in Omaha. She assists with case management for older adults in a permanent supportive housing and emergency shelter. She will begin medical school in the fall. Thank you all so much for being here. So it's no surprise to all of you watching that our aging population is going to take all of us to come together to support seniors and those who care for them. And we know that family members are oftentimes the first one to step up, but it's really going to take an entire village of people. And so I want to think about the village being comprised of the professional caregivers across the senior care continuum, the volunteers who want to give back to the aging population no matter their age, and members of society, all of us, that can really help with things as simple as taking an elderly neighbor's trash out. So today, each of these panelists represents those various groups, and I'm really excited to hear from each one of them. So let's start by talking first about family members. Again, family is the first to step up. Obviously, they're closest to our seniors. And the Caregiving in the U.S. 2020 report revealed an increase in the number of family caregivers in the U.S. from 43.5 million in 2015 to 53 million in 2020. So family caregivers now encompass more than 1 in 5 Americans. And the study also revealed that family caregivers are in worse health compared to 5 years ago. No surprise, when we start caring for someone else, our own health then begins to suffer. So Dr. Olsen, the Rosalynn Carter Institute really focuses on the unpaid or the informal family caregiver. But a lot of times this person doesn't even realize they're a caregiver. They think they're just being a son or a daughter, and this is what they should be doing. Can you tell us about the work that you're doing to really help those people self-identify as caregivers and then also accept help from others so that they can receive some respite?
Sure, thank you. One of the biggest areas that we focus on is to recognize that caregivers are amongst us. From the clerk at the grocery store to the CEO to the fireman, all of those individuals can or will be in a caregiving role. And as you mentioned, people don't use that term of caregiver very often. And so we often end up having conversations with people about the tasks that they do. So if you walk into a room of caregivers, you might get only a few people who raise their hand and say, yes, I'm a caregiver. But if you ask who picks up pharmacy, goes to the pharmacy for somebody, who helps pick up groceries, who brings somebody to their medical appointments, you would get so many more hands raised. So our work is to help think of ways to nudge individuals into recognizing their role as a caregiver. I often think about the pharmacist is actually probably the first person who notices when a family caregiver takes their role, because they see that person come in and pick things up for someone else. And so who are those structures around caregivers that we can engage with to support individuals where they live, work, and play? If you want to use kind of a public health terminology there. And I think one of the elements for us is realizing that, yes, there's a role for policy to come into play to change to support caregivers, employers, community leaders, the education sector, kind of across the board, which would be critical. We've been working through different ways to engage caregivers in both identifying or seeking out respite supports and services, as well as engaging in coaching programs. We have a partnership with HFC and Home Instead as part of this work to look at, while somebody is getting some respite, can we also help them build some skills with self-care and engagement? So what are kind of different ways to combine services and supports? And what are ways to look at all the different factors? We use this term of social determinants of health, right? Where how you're eating, if there's great public transportation, what is your environment? How does caregiving interact with all those other factors? And I'm optimistic because I think conversations around the fact that there's a lot that impacts our health and our well-being, and there's a lot of interactions between those elements. And so maybe one of the things post-COVID is a recognition of how caregivers can be supported more holistically.
Dr. Olsen, how do you see this changing as future generations become caregivers? Do you think that it's going to be less taboo? Do you think there's going to be more understanding around it?
I do think so. I think unlike maybe some of the ways where caregiver wasn't a term or caring for someone wasn't a conversation, we see a lot more coverage in the media, policymakers talking about care and supports, employers looking at their role in supporting people's mental health and their well-being. And so how can caregiver supports be put into play there? And I also think there's some work that AARP put out talking about millennial caregivers and their kind of, I'll say, dread and fear that they have of this role. And I'm hopeful that fear will drive us to make bold changes so that people don't go through what they've seen their parents or grandparents go through in a caregiving role, that we make a better environment for the future.
Well, you just gave me a beautiful segue right there. You are right. The future generation of caregiving really is those millennials, and AARP has done some research in this area. And Ian, thank you so much for joining us. We are really seeing an increased number in those millennials becoming the family caregivers. And research, as Dr. Olsen mentioned, is really showing that this is having a significant impact on their careers, their family lives, mental health, and more. So not sure, I can't quite see you on the panel, so maybe you didn't make it on, but I am going to go ahead and share with this group what Dr. Olsen mentioned in terms of this research. I find it fascinating. I'm actually going to read some of your notes that you shared with us since you're not able to be on this panel. Ian says that it has been truly a learning experience working with his colleagues to explore the last few years. They've actually been looking at the unique challenges facing younger caregivers. And so with so many issues like family caregiving, COVID-19 really brought a spotlight to this. So I actually think that this pandemic really brought to light what's been happening. So I'm a silver linings gal and looking at all of the silver linings that come from this. And I think what we really learned is underscoring the experience of the younger caregiver, but not only noticing them as becoming more and more prevalent, but also understanding what caregivers have been dealing with on a day-to-day basis. Now, what AARP finds unique about being a millennial caregiver is really the expectation of their friends and their colleagues, and how they've heard so many times about their life being interrupted by caregiving responsibilities. They definitely did not prepare in their life for this oh no moment where all of a sudden they have to stop what they're doing and growing up in life to go care for a sibling or a parent or a grandparent, and then having to put their entire life on hold. So again, I think it's really about disrupting those stereotypes and understanding that family caregivers are not just older adults caring for people, but younger people who also have children of their own. We call them the sandwich generation. They're trying to raise kids, but they're trying to help their own parents or grandparents and hold a job. So last year they did a research study with 5 million student family caregivers, and they were from all generations and were working to drive awareness of the challenges that face completing their education. So whether they were an undergrad, a grad, or in professional studies, simultaneously caring for family members, they found that caring for a loved one affected the academic performance of 7 in 10. So he said 1 in 5 people are caring for someone as a caregiver, but the academic performance of these students who are trying to excel and educate themselves for their future, 7 in 10 of them are caring for someone as well. So I find that just fascinating what people are actually struggling with, and how it's not just the retired woman who's caring for her elderly mother, and how we really need to think about how this is affecting everyone. So in addition to family, we know that professional caregivers play a huge important role in care of the aging population. So Helen, I am so impressed with your numbers as well. Educating 30,000 in-home care professionals to provide excellent care. So impressed with the wonderful technology platform that you have provided at CareAcademy. And then this goal of training 1 million caregiving professionals. Can you share with us how your platform has helped to train and retain professional caregivers? And then tell us how you plan to reach this goal.
Absolutely. Well, thank you so much for having me on. I'm very excited about the fact that we're even discussing caregiving. I think to your point earlier, Erin, caregiving is coming out of the shadows. I think born out of this pandemic, there's a bright spotlight and a future ahead. And that really comes in tying direct care and direct care work and professionalism with healthcare and the future of healthcare. I think I'm really heartened by the emergence of this mantra that's developed in home care, that the future of healthcare is home care. And I always love to just talk about the direct care workforce. I've been a part of the direct care workforce as a caregiver. We know this encompasses, or the system recognizes, over 5 million direct care workers. To date, we've actually been, as a result of this pandemic, we've grown significantly, and our numbers are, we report having trained actually about 150,000 direct care workers just in the last couple years. And so, when we talk about direct care workers in different states, they have different classifications. The thing that I always want to make sure we come back to, just even in the same lens as we've been speaking about family caregivers, is that primarily, professional and direct care workers are also family caregivers. I think that's really important to note. And knowing that, we think about our platform as an accessibility tool, right? As a direct care worker, or even as a family caregiver, I thought Dr. Olsen did a really magnificent job speaking about this. You want resources and you want wraparounds. That's true for family caregivers. That's also true for professional caregivers. And that's what our platform really aims to be, and what we built at CareAcademy. The idea is that we have built a platform that serves short, bite-sized, interstitial content, so scenario-based. So if you are a direct care worker working with someone who has dementia, the classes are showing you a scenario where someone may, be having symptoms of sundowning, right? And how do you handle it for agitation? We hire actors to really walk through what that will look like. And we often found that context was really missing. We have a number of direct care workers who really enjoy the classes and the platform that we provide from that perspective, and also see this as a way of helping themselves as family members. And accessibility is really key. And so we think about how do we reach a direct care worker population in terms of the languages that are served. So we offer not only that high tech piece, but also the high touch piece, where we're providing language supports in both English and Spanish. The classes that we have, based on where you are regionally, because we serve across the US and Canada, also have different classes served up in different languages, from Russian to Haitian Creole to Mandarin, because we know that just like the family caregiving population, the direct care worker population is diverse, and we need them to be diverse to serve a diverse set of needs and across generational needs as well. And so in terms of how we intend to reach that goal, sorry about that, we've got so I've got fire alarms and everything going on behind me. We're really thinking about not only just serving up content. I don't think that's enough, but it's realizing, and I say this often whenever I get a chance to, caregivers contain multitudes. So the way that we imagine reaching this phenomenal goal of 1 million direct care workers from now until 2023 is really about thinking about our content and our classes, our platform, as just bridging a gap, and as the ability of our platform to attract new folks who already are caregivers. As you mentioned, and I think we'll highlight several times, everyone at some point is a caregiver. So you already have some of the capacity and skills there. And so our job as a platform is really to help build upon those skills. And that's often what we find ourselves doing. We think of our classes during the pandemic. We knew millions of people were out of work. So what we did is we provided just a set number of classes that could really attract folks who may have been doing some caregiving work with a family member, with a parent, and just needed to see what it looked like to do that with other folks. And really, we had 2,000 people introduced into direct care work. We were able to get 400 people out to work in just a couple of months, just based on utilizing and leveraging the content and classes. And so, we're really excited by, I think, the silver lining of this pandemic. It's been really unfortunate, but the silver lining coming out of this is, we have now national and international attention to the importance of direct care workers, namely the Biden administration proposed a couple weeks ago $400 billion that is really meant to not only provide access to care, but also care for the carers, making sure that we can look at ways of raising wages and providing for sustainable a living wage, essentially coming out of direct care, which really builds the capacity, which also helps and aids us in our vision of adding 1 million new direct care workers into the field. So I'm really excited to be here, and thank you so much.
Absolutely. It all comes down to the caregiver, which is really all of us. And the point of this session too, even as members of society, we're caregivers to the person we see, to the senior we see at the grocery store, to our elderly neighbor, I think, and education is so key. And another great thing that's happened with the Biden administration is the recent $1 billion announcement to highlight service years, which is a great segue for me to introduce Miss Natalie. She is part of a program that we started here at Homestead a few years ago called Champions of Aging. And what we're trying to do is to take students who have graduated from college and want to take a gap year and really put them in a situation that is an immersive experience with seniors, so that regardless of what they go do, they are aging advocates. So think about if someone goes and becomes a city planner or a banker or a lawyer. Luckily for Natalie, she's becoming a gerontologist. She's going to go to medical school. But what she has been able to learn working with the senior population at her service site, which is actually a homeless shelter here in Omaha, is just the variety of needs that seniors have in general and when they are homeless and needing services. So Natalie, please just let us know what even made you interested in taking a chance on a new program like Champions of Aging, and what have you learned from it, and how do you plan to take it forward into your medical career?
So when I was getting ready to go into my senior year of college, I knew logistically, as I was applying to medical school, I wanted to take a gap year. And so I was meeting with a professor in the gerontology department. She was working with me on my honors thesis, and we were just discussing what I would be doing during my year off. And I mentioned that I really wanted to directly be helping people in the community somehow. And I had been looking into service year opportunities. And she had just gotten back from a meeting where she had learned about Champions of Aging prior to when it was actually started. So she kind of talked to me about what it might be. And I was immediately interested in it because I had had all of this experience in my gerontology courses, and I knew I was interested in geriatrics as I approached applying for medical school. So those kind of met in the middle, and I applied and got accepted to the program, and I've been grateful for the opportunity and everything I've been able to learn and will be able to take forward. So there's certainly a lot that I have learned on a day-to-day. Probably the biggest thing is just how to navigate the different systems that my clients have to deal with as they try to find housing, work, healthcare, and just try to get on their feet to progress in their lives. I have learned how to help somebody apply for Medicaid and how long that process can take. Currently, we've got a woman in our shelter. She came to us from the hospital, and she can't bathe herself. She can't dress herself. She struggles with incontinence, and she has nowhere else to go. The hospital just sent her to us. And so we've been working on trying to figure out, she has California Medicaid. So how do we get her Nebraska Medicaid? She has, she needs a higher level of care. Can she get into assisted living? We've talked to some assisted living facilities and they think she's too high level care for them. So now we're talking to skilled nursing facilities and trying to navigate that process. Certainly in an emergent situation, and with people who often don't have family members or friends in their lives to help them navigate that process. So over time, I've definitely, particularly with my clients in permanent supportive housing who live in the apartments, you just get to know them to a point where you can kind of, I feel like I am a caregiver for them as they navigate their health and those things. And then the other piece of it is just also recognizing their individual stories and navigating. I feel strongly about trying to combat social isolation with them. And so as much as our meetings are about their goals, setting goals, finding resources, we also spend a lot of time just talking about their lives and their careers. I've got a client that was a surgical tech for decades, and so we'll talk about his time doing trauma surgeries and being in the operating room. So definitely, as much as I've learned about helping people navigate systems and get on their feet, I've also just learned how to help people grow in their goals, because certainly it's not just about trying to get into a house, but it's also about how to expand their life and get into what they're passionate about. And as far as taking it forward, there's a lot that I've learned that I'll use in my career in medicine, just recognizing where a doctor stands as a piece of the puzzle and all of the factors that influence somebody's health and how their health influences their ability to remain housed, to keep their job. It all flows together, and I've seen that this year. So.
Natalie, you're such an inspiration to me, and I think a great example of that younger generation of caregiver that we're talking about. Thank you for all of the amazing work that you do and continue to do to support seniors, and we're very excited to watch and see where your medical career takes you. I think now what I want to do is really just open it up to our group of panelists and just talk about us as people, all of us on this call, all of us in society, our jobs and specific roles aside. What are your thoughts or dreams of how we can make this world just a better place to age? Because it's the one commonality that we all have in the world. We're all growing older. We're all going to be a part of this. Let's just talk about what that looks like. Helen, do you want to get started?
Absolutely, and happy to. I think for us, and this actually is distilled in our mission of CareAcademy, that ultimately our vision of aging in place and aging successfully is about choice, right? And then it is incumbent upon, policy, upon companies and products to support choice and facilitate aging where you want to be and where you're successful. We know that there's really great research by the AARP and acknowledging that, currently seniors and older adults really see their home and community as the best place to age. For us as people, which is your lead into this, Erin, I would certainly want to age with my family as well. And so when we were talking about some of the policy decisions and frameworks and opportunities that are emerging, is how do we facilitate that better? And whether it is, empowering direct care workers to learn, what are the best means of making sure they can care for someone in their communities, because typically direct care workers are part of communities. We mentioned this earlier, but, a new model that is emerging are community-based supports and community-based workers who might be neighbors, who might be friends of older adults that are actually part of this powerful group that we call at CareAcademy the Circle of Care. And so how do we empower the circle of care wherever and, along the process of aging, ensuring that there are multiple choices and one doesn't sort of, get more attention than the other, which I think has typically been our current operational lens of caring and aging in place, but we're able to offer multiple choices and make them available as we age is really the vision for us.
I love that. No matter how old we are, we want choices. We don't want to be told this is what's happening to you. And I really appreciate that insight. Helen, Dr. Olsen.
For us, I think a lot about preparedness, that if you were going to go in for surgery and you needed somebody to come pick you up, you'd want them to show up with a car that has gas in it, have their driver's license, know what time to show up, know where they're taking you, all of those elements. But we don't have kind of the same approach to supporting caregivers. People get a phone call about a diagnosis, or they find out about an incident that happened to somebody that they love, and they're all of a sudden in this kind of caregiver role for a family member. Or I think in thinking about the communities that Helen works so closely with, you could have a day job as a caregiver and you could have your night job as a caregiver. And you still are always kind of caught in this place of surprise. No matter, I think, how much skill you have, people are still kind of experiencing this. It's another thing, or it's another challenge. And so I think for us, we think a lot about like how do we change our conversation to be one more of preparedness for the changes or the challenges that we'll all experience, either caring for somebody or what we want the people caring for us to have. I want that person who's going to pick me up to have their driver's license, and if they need glasses, to have their glasses. Don't I want the same if there are skills that they could learn about how to care for me, or how to maybe help me move, and what does that need to look like, and what are ways to inject kind of elements around understanding that caregiver journey as early as possible. We work with Sesame Street on a project to talk to children about their caregiving responsibilities in especially military families. And it reminds me all the time that like there's no reason we couldn't help people build care skills at that earliest point, but it will take kind of a societal approach to that.
I absolutely love that. I think about a program Home Instead has. It's called the 40-70 rule, and it's about when you're 40 and your parents are 70, which is where I'm at in my life. Have the difficult conversation. Talk about the preparedness. You say, like, why do we wait for the phone call? Why do we wait for dad to wreck the car before we talk about what it means to take the car keys away? Like, we wait, and then it's just awkward and hard and intense. And it's like, I thank Home Instead for educating me enough to have these conversations with my parents and my siblings about these things so that it's not an emergency issue. It's really something. So I would love to challenge all of us to have difficult conversations, and they're a lot less difficult when you're not in the moment, and you can have clear thinking and wishes. And it's about all of us. It's not just what your parents want, but what do you as a caregiver want? And talking to your parents or loved ones about that. So I absolutely love preparedness. And Natalie, I'd love to hear you speak about, recent college grad. What is your generation? What would you love to see from your generation, or what do you think your generation's doing really well to prepare this world to be ready to care, to prepare this world to be more open to an aging population?
I think where I see a lot of strengths are those who engage in intergenerational connections across the board as they're working, in who they interact with. I definitely I have some friends that were in medical school and just in college. And as the pandemic came around, I saw a lot of college students step up and try to reach out to older adults in the community to ensure that they weren't isolated. And I think that that's important for all young people as they grow older to establish relationships with the older people in their lives and around them in their community. Because as you have those connections to people, I think it just helps you to appreciate them and see their strengths and values as they age, in addition to the ways in which they need help or in the ways that they're challenged.
Yeah, I love that. When the pandemic started, we started a pen pal program through our Ready to Care platform, and it's going so strong. In fact, we have so many letters, we can't get them into the seniors' hands fast enough. So if any of you out there know of seniors who would love to get a pen pal letter, please email me at info@readytocare.com. I see letters flying in from colleges. I don't know if professors are giving it as, some coursework, but they're amazing, thoughtful letters from these students who are just sharing their stories and asking for advice. And it has been something so uplifting to me. So I'm so glad that people are really learning from that, multi-generational. And Dr. Olsen, I didn't know about the Sesame Street link, so that's very, very cool. I love that. We gotta start them young. Helen, what would you tell our audience today, from your perspective? What is something they could do to help themselves as an individual, help this world become more ready to care?
Absolutely. I think there may be a couple, best practices and feedback, but I often think that the most simple takeaway is, to the point that everyone has made today in terms of, assessing within your community, within your family group, really, who is aging and and starting that conversation. A lot of my advice giving is to folks as professional caregivers, but as has been recognized several times, professional caregivers are also family caregivers as well, right? And there was this really powerful image that's made me think a lot about how are we caring for professional caregivers as family caregivers. In the New York Times, it showed a woman who worked as a home health aide and was caring for her brother who had no other family members, who had just recently had a stroke, right? I think in this time where there's a lot of social isolation born out of the pandemic, we can talk about aging as a sort of really large, heady societal issue, but caring starts, at home. And so whether it's your immediate family or folks in your community who could use a little bit of help, there are a lot of resources in terms of bridging and broaching that conversation of how to best help and talk about giving help. But there are a lot of folks in your community who could use even just something as simple as a conversation, if not some help with some day-to-day, tasks as well. So having that conversation with folks in your immediate circle.
That's great. Thank you. And Dr. Olsen, what would you say to those caregivers, all of us really, who will be caregivers? What advice do you have for people as they embark on a journey and may think that they are just doing the duties of being a daughter or a son?
I think a lot of it for me is about this this kind of community element. I think about, Mrs. Carter always reminds me that we can talk big policy change, but we still have to reach and connect with individual caregivers and be very careful in asking a caregiver how they're doing. A lot of times people, they do it from a place of love and concern, but they ask about how the person that the caregiver is caring for is. So, you call and say, like, how's grandma? And you're talking to grandpa and you don't ask him how he is, or somebody, you see a neighbor on the street who you know is in a caregiving role and you ask how the person who did just come home from the hospital is, rather than saying, how are you doing? I think caregivers are really good at thinking about the other person. Our job in supporting caregivers is to think about them, to ask how they are, to find ways to be supportive of them in their really critical role to our society and communities, and to just kind of be cautious about thinking about their needs as a population that they are, a critical population.
I absolutely love that. Very good point and reminder. All right. Well, I think we are going to go ahead and open it up for some Q&A. Leanne, I will let you take it from here. Let us know if we have any questions.
Yeah, we have a couple. Can you hear me okay?
Yep.
Okay. First one for Helen. Does CareAcademy offer peer support groups for family or professionals?
That's a great question. Pre-pandemic, we were sort of developing these out with our, we work directly with employers of direct care workers, but now that has all gone digital. So we actually have a Facebook group. Facebook is one of the best aggregators across all types of caregivers. It's actually a population of millennials on up who are the fastest growing segment on Facebook. And so we have a Facebook group that is just meant to build in supports outside of just content and classes. We realize that to everyone's brilliant, notes on the panel, that caregivers also need to be cared for. And so it's just a really great community that we've developed of over, I think at this point, 300 or 400 direct care workers throughout the U.S. who are, talking to one another. There are a number of different organizations facilitating the same thing, but we really love our community.
Wow. Okay, and a second question for Helen, and maybe others want to weigh in too. Can you talk about about empowering professional caregivers in institutional settings? This person is recognizing that professional caregivers are often the most underutilized, underpaid, often not well treated. So what can we do to empower them?
I wholeheartedly agree, and I saw this question, and I think this is not even just institutional. I think this is across the board. I want to be very specific about how we support, because we can talk about sort of the sort of the wraparounds and some of the sort of societal views, but I think just speaking more directly to it, I think it's in terms of pay and empowerment. For us at CareAcademy realize that, very often it's people come and say, oh, you need to, educate direct care workers, or they come with sort of a level of, a mindset of, well, maybe folks don't want to seek out education or opportunities to grow. And we've actually, just from the engagement that we see with direct care workers, whether in institutionalized setting or home settings, by far, folks are already looking at upskilling and building their skills with or without CareAcademy, right? So we often say it's not direct care workers or their need for, realizing opportunity or education. They want all of those things. And they realize how important the job is, but does the system also realize how important their job is? So whether it comes down to pay, upskilling, and then also realizing pay and advancement and opportunities, we're very specific in terms of, this new normal of looking at how caregivers are seen as even more useful than I think, and just an intrinsic part of how we're going to make healthcare available for everyone. So I think advocating for the state of Virginia, as well as a number of other states, have some really great and interesting policy demands in terms of, offering time off. And I want to see if we can make those things writ large in order to elevate the caregiver.
Yeah. Anyone else?
Ask Helen a question? This is,
Yeah.
I know, unusual. So Helen, one thing that seems to be anecdotally understood is that people have a family caregiving history or a friend caregiving history, and then they are, curious about getting into a more professional role, or their caregiving journey comes to an end, as it often does, and they want to kind of continue. Do you see that there are kind of clear paths for that, or opportunities? And then I would imagine the reverse is true. A person's a professional caregiver, and then their whole family just starts saying, well, you're the family's caregiver. You do this for work. So, now can you take care of every relative we have also? So can you just kind of talk about that? I guess it's kind of like a path that happens, or people's journey back and forth.
My background is in education and policy, and predating a lot of the work that we're doing, we didn't see a whole lot of very clear pathways. And I still actually would argue that they don't really exist. We had, even more recently with this pilot that we rolled out, we said, what if we could create as clear as possible a way for someone who is interested in direct care work to become a caregiver. Let's just make it passively available. So we'll enable, 20 hours that translates to something. We did a lot of that map making work of saying, if I am in Massachusetts or in Michigan, what does it look like to enable becoming a home health aide? Because a lot of that transfer work hadn't already been done. And so we were finding ourselves doing that in order to offer this set amount of time. And so I think, Dr. Olsen, to your question, before, as we think about the opportunity to expand the workforce and create pathways, there are none right now. There's no sort of federally mandated way of creating a direct care worker force. We are really stitching together and matchmaking across all 50 states right now as a company, which, we're excited to do. However, I think there's a big opportunity to really sit down across the island, across these multiple states, and say, one for one, can we agree on what makes a professional caregiver? And we're excited, I think, because of what has been mandated and the policy frameworks that the administration is developing, that there might be an opportunity to do that. And to get to your other question around, you have been the professional caregiver and thus you become the family caregiver. Caregiving, by and large, is very genderized work, right? We know that's 90% plus. It's either the framework is it's either the oldest daughter or a daughter or a woman of sorts, right? So regardless of whether they are fortunate to be a home health aide and have some perspective, it's going to be largely fall to a woman or the oldest daughter. It's starting to change as we see, and part of what we I think even discussed leading up to this panel is the fact that we see, especially among millennials, there are more men who are engaging as caregivers. I think that what we're starting to see that's really interesting is a gray area between who is a professional and who's a family caregiver even more. I think because we are so constrained from a capacity standpoint, we just need more caregivers, that states are starting to implement and open up the idea of compensating someone who's a family caregiver to directly just be the caregiver in community. And we're excited by that, right? It means that there's a world where, and we imagine at CareAcademy, a world where, that there's even more graying of that, and everyone is in some way a caregiver and is empowered and enabled with the resources to be supported, right? Whatever form that may come in. So I definitely, I really appreciate your question. Those are great questions, Dr. Olsen. I didn't pay her to ask those questions, but I think we're certainly seeing some trends emerging, but I take also heart in that there's a lot of work to be done in terms of making that pathway and that connection clear everywhere, no matter where you are in this country.
Well, and I think it takes all of us to advocate for those things. I mean, we've got a policy and advocacy group that works tirelessly to get some of those things recognized. We get these HSA dollars or FSA dollars for childcare, but, there's senior care. And then also we are wrapping up a workforce report as well. So happy to share that when ready. Leanne, any other questions?
Yeah, we're getting a lot coming in. So,
Great.
Helen, you touched on the issue of paying family caregivers, and that's a good segue. There's a question: is there a way for a family caregiver to be paid for taking care of their family member if that family member doesn't have Medicaid? So.
I don't have, and I'm going to see if there's a way we can provide resources. I don't have sort of this information offhand. I just have Medicaid directed programs and family directed programs. I know of a smattering of states that are offering and have made provisions for family members to get paid as direct care workers. I think that I'm interested in how Medicare, I'm by no means an expert on this. I'm sure across ASA, there are lots of experts on this, but how Medicare Advantage potentially may provide some level of flexibility. I know that there's some opportunity around provision of care at Medicare Advantage for professional caregivers, but not necessarily, I'm not sure about the family caregivers. So so the short answer is I don't exactly know how that would work, but I am really sort of eager to find out, and I'll posit that internally within CareAcademy and see if we can get resources. And I'll take note of Kathleen's So thank you so much, Kathleen, for that. And we'll have to do some digging on that.
Any other panelists that want to jump in? Okay. Yeah, the cash and counseling demonstrations that started, gosh, probably 20 years ago, that immediately comes to mind. I know some states have funded that through state plan dollars, not just Medicaid, but yeah, I'm a little out of date with that myself. Any insight into how immigration reform might impact the availability of paid caregivers?
Is that a question for? I think that question could be for anyone, but I'll take a stab at it. That is actually something that we're working with, because there's we note that of the 100,000 plus direct care workers on our platform, folks identify 40% identify as women of color and or from immigrant backgrounds. So I think it's safe to say in our industry there's a high correlation in terms of the availability of paid caregivers, and are we opening up the aperture for folks to work within this a country that has smatterings across it of an aging population. So I live in New England, and Maine is actually the oldest state in America. Just recently there's a high impact in terms of the availability of workforce just based on legislation. And so there's a high correlation, definitely, and we know that as part of holistically looking at the availability of direct care workers, it's looking at educating folks, it's looking at attracting folks into the workforce, and it's also looking at just, where are the pockets and the opportunities. My parents immigrated to this country as direct care workers and, certainly provided me an opportunity. So I think that there's a high opportunity there.
Dr. Olsen, are you seeing anything in terms of immigration caregivers?
No, but I think the question reminds us of how interconnected any kind of policy moves are. We on our team talk through any news story or any change, there's probably some impact on caregivers of all sorts. And just that recognition of that connectivity is important for any sort of labor, immigration, even policy we wouldn't think is necessarily related will impact a caregiver.
Natalie, are you seeing anything at the Stevens Center in terms of just immigrant seniors who are needing care?
Well, since we're located in South Omaha, which has a larger Latino population in our community, we do have some individuals who come in that speak Spanish, and across the board, I know in the homeless population, there's definitely there's a large population of minority individuals. So we see that too. But I don't know that I've seen any particular trends changing over this past couple of years.
Really good questions.
Here's a fun one. What are some of your favorite websites, books, or other sources of literature for caregivers to learn from? Who wants to go first?
Dr. Olsen.
Sure. Shameless plug, rosalyncarter.org for our work. But the other, I think, area where we are learning that there's kind of a gap in knowledge is people who are caring for someone who is older may not realize that they might be able to benefit from their local area agency on aging for connection to resources, especially locally. You often think of that as for the person who's aging, but younger caregivers can in some ways benefit from programs that are offered through that, especially since so much of care needs are local.
Anyone else have any go-to resources?
Oh, I have one. I think there are a couple really interesting sort of pockets of talking about aging and also talking about caregiving. I think Working Daughter and some of these sort of communities that have developed around family caregivers are really interesting. Obviously, shameless plug for CareAcademy as well for direct care workers. Paula Spann and the New Old Age, I believe, I think is a really great resource. And then also a go-to for me is the AARP as well. And there are a couple books that I'm looking at. I believe, oh my goodness, I'm forgetting his name, and it'll come to me maybe by the next question. There's a professor here who oversees MIT's aging lab. Where's
Joe
the book?
Coughlin?
Yes, Joe Coughlin. Joe Coughlin's book around sort of the aging economy is also really great too. So yeah.
Yeah, and of course, there's always our friends at the National Alliance for Caregiving, NAC.org, and the Family Caregiver Alliance, which is West Coast based.
And the organization I'm on the board of, the Caregiver Action Network, which I should also plug to. They'll be like, really?
Yeah, I also think something we haven't talked about a lot today is the caregiver for someone with Alzheimer's or other dementias, a whole different level of caregiving. And so the 36-hour day is a really great book for family caring for someone with Alzheimer's or dementia.
That's great. And we are right at time. So I just want to say thank you to all of our panelists. Thank you to Home Instead for your partnership. Erin, any final thoughts from you?
Yeah, no, I just want to thank everyone who attended today and really thank our panelists for the time that it took to build this panel today. I just absolutely think it's going to take all of us to make this world a better place to care. And I will do one more plug for readytocare.com. You can sign up for weekly acts of kindness and see all sorts of other resources to give, learn, and serve in your local communities. Thank you so much to ASA for the opportunity. Appreciate you all.
Yep, thank you. And everyone enjoy On Aging.